So a little bit more about my journey, the condition ankylosing spondylitis. If you're someone out there who suffered with ankylosing spondylitis, whether it's been a couple years or it's been 2 decades like I have, you understand how devastating this disease can be. It's extremely painful. So if you're a loved one that knows someone who lives with ankylosing spondylitis, believe me, the pain that they tell you that they're in, it is real. It is very real. It is probably one of the most painful conditions that's out there. Like I said, it can affect any joint in the body, but mainly the entire spine, especially at the low back, the sacroiliac joints, the hip joints, the ribs, the sternum. Extremely, extremely painful. It's sometimes every step you take is just excruciating. But this is what can happen because it is affecting the entire spine. So you can see this picture right here. That's what our posture should look like, how my posture is right here, even after 20 years later. And I'll go into why I'm able to maintain my posture like that after 20 years of this chronic degenerative disease of the spine. So here we have the posture, how it should be. Here's 10 years later, after having AS, which is short. Most people, not only can they not spell ankylosing spondylitis, they definitely don't know how to say it, which is frustrating for us who do have it. We want to educate people about the condition and how devastating it can be. And that's my passion, to help people with that condition and all of the other problems that can manifest along with it. But here we are 10 years later. You can see the spine already kind of going in that hunched over position. Here we are 20 years later, which physiology is telling us where I should be, but I'm not because of everything I do, because of my medicine, naturopathic medicine, functional medicine. The exercise program, foundation training keeps me like this even after 20 years later. That's why I'm so passionate about this medicine, and I know it works because it's what it's done for me in my 20-year journey and what it does for all the patients that I see and the people that I help and the lives that I change. That's why I know this medicine works, why I know it's for real. Here we are, 30. Here's the difference between what we do with naturopathic functional medicine and what's out there conventionally and mainstream that a lot of people are getting. Let's just take chronic low back pain or chronic back pain, for instance. And this is why we have the opioid epidemic that we do. And we know the side effects. You watch CNN or Fox News or whatever your news channel is. It's almost every single night now. For crying out loud, Macklemore did a rap song. And look it up. Look up that song he did about painkillers and the opioid addiction. It's fantastic. I think President Obama invited the White House to talk about the opioid addiction and problem we have. And that's because painkillers are being handed out like candy, especially for chronic back pain. Well, what I do in my practice, because it was so life-changing for me, the exercise program, foundation training, literally transformed my life with my condition, a chronic degenerative inflammatory disease that's supposed to just destroy the spine and put me into this position. But 20 years later, I'm still like this, and that is for 2 reasons. What I do internally with nutrition, botanical medicine, supplementation, nutraceutical formulations, I've taken down the inflammation in my body. I've healed my gut. I'm going to talk about that tonight. And the exercise program, foundation training that was developed by a chiropractor, Dr. Eric Goodman, and you deserve all the credit in the world for developing this exercise program. It's changed my life, and it's changed many, many other people's lives as well. So thank you for that. You deserve all the credit for developing that exercise program. So again, a solution, foundation training, an exercise program, as opposed to painkillers and their devastating side effects. So autoimmune disease, let's take an autoimmune disease or a chronic inflammatory disease like ankylosing spondylitis, but rheumatoid arthritis, Hashimoto's thyroiditis. It leads to hypothyroidism. We've got a lot of people out there that struggle with hypothyroid. That a lot of times is due to autoantibodies attacking the thyroid gland. Sjogren's, SLE, we have a lot of autoimmune diseases. So we got 2 choices here, like I was on, the harsh corticosteroids and other immunosuppressants, and a lot of people out there, I know if you have ankylosing spondylitis, you're most likely on Humira, Enbrel, the TNF-alpha inhibitors. We know they suppress the immune system, have side effects such as infections like tuberculosis or cancers, lymphomas. That's because we are severely suppressing the immune system. Or what I'll do in my practice with functional medicine, naturopathic medicine, is I'll go right to the source of this chronic inflammation, which is in the GI tract, which is in our gut. From a leaky gut, which this picture depicts, just the other night, you've probably seen the lecture that I gave about leaky gut and autoimmune disease, and I'm just going to reiterate that again tonight because I'm talking about my condition, and you know, as opposed to these immunosuppressants, we can just go right to the gut, heal that gut lining, and shut that inflammation off at its source without having those severe side effects.